Hello and welcome to the Fit to Transform podcast, where you learn how to train and diet effectively and, most importantly, how to maintain those results for life, once and for all. I'm Nikias Tomasiello, a transgender training and nutrition coach working online with anyone who's ready for a true lifestyle transformation, anywhere they may be in the world. As a friendly reminder, any and all information provided is for educational purposes only. You should consult with your doctor before implementing any changes to your diet and exercise program. With that disclaimer out of the way, thank you for being here. Now grab yourself a cup of tea or pre-workouts and enjoy. Yo, welcome back to the podcast and thanks for tuning in. Today I am going to interview Dr. Mike Challis, an online coach for Revive Stronger and a physiotherapist. We're going to cover the differences between physiotherapy and chiropractic, some common misconceptions about training, such as letting your knees go over your toes when you're squatting and whether that's safe or not. We're going to discuss how to navigate pain in the gym and how to navigate an injury if you unfortunately are recovering from one. I think you're going to learn a lot from this podcast. So without further ado, let's get straight into it. Yo, dear listeners, welcome back to the podcast. Today I have a special guest, Dr. Mike Challis. Mike, thank you so much for coming on the podcast today.
It's an absolute pleasure, Nikias, and thank you for having me.
You are very welcome. Today I want to delve into the topic of physiotherapy, pain, injury, and some facts or myths that are related to pain and injury, especially as it pertains to lifting weights in the gym. But first, a question I ask all of my guests is, who are you? What do you do? And why are you so awesome at it?
I'm not sure if I would say I'm awesome at it, but my name's Mike, as you said, and my primary profession is physiotherapy, so I'm a physiotherapist. And I've been a physiotherapist now since I qualified in 2011. So what's that? Nearly 12 years. And for the past probably almost a year, I've been a coach with Revive Stronger. So those are my primary professions. But since I was probably about 16, 17, I've been training in the gym, and I would probably class myself as a bodybuilder, although I have also dabbled in powerlifting, a little bit of strongman, and even a little bit of CrossFit as well over the years. But bodybuilding, being a natural bodybuilder, is what I'd classify myself as now, and that's my passion and who I love to help. So yeah, that's me.
Thank you for the introduction. Although I've had Steve on the podcast before, so most people will be aware of Revive Stronger, just to make sure that everybody's on the same page. When you say that you're a coach for Revive Stronger, does that mean that you provide online training and nutrition, or is it different?
No, that's completely correct. So I provide online training and nutrition, as well as also being a physiotherapist as well. So we tend to separate the two, but yeah, provide both those services.
Excellent. Thank you for clarifying. So, I usually like to start with definitions because I believe that they set the tone for the conversation so everybody understands what the rest of the conversation will be about. And what I find really interesting personally is the difference between a physiotherapist, a chiropractor, and then the difference in scope of practice between physiotherapist, chiropractor, and an online coach or personal trainer. So if you could delve a little bit into that, that would be super helpful.
Of course. And I think this is a really common area of confusion, and people don't necessarily know who to go to sometimes. So I guess like the main differences are, so firstly, it comes down to regulation. So firstly, physiotherapists are a recognized and regulated health profession by what's called the Healthcare Professionals Council. So what this means is that if, for example, within a physiotherapist scope of practice, because they've got that regulatory body, if the regulatory body saw a physiotherapist acting outside of their scope of practice, then obviously they would take that title of a physiotherapist away from them. So that's a major distinction. And whilst chiropractors may have some regulatory bodies, it's not necessarily with the Healthcare Professionals Council. Also, the other difference between chiropractors and physiotherapists comes down to how they're trained as well. So within chiropractic, now I'm not an expert when it comes to chiropractic, but my understanding is that you've got two or three different types of chiropractic type therapy. So one of them is McTimoney, which is the lesser well known, which is kind of more based on very kind of fine manual therapy based movements. But then the major kind of most common form of chiropractic is where essentially their education and their training centers around the spine, and kind of what they'll do is they'll perform manual therapy or manipulation around the spine to help with a particular problem. Now, then the difference comes, and I apologize to any kind of chiropractors that might be listening. I know that I'm not an expert on that, so if I've got anything wrong, please feel free to kind of correct me. But when it comes to physiotherapy, the training is much more, I would say, widespread, and how our approach to approaching the body is potentially a lot more global. And also, firstly, so chiropractors aren't necessarily trained in any UK university, so it's not really an undergraduate degree. It's something that you'd go to a smaller college for, but not like one of the mainstream universities. Whereas, at least in the UK, to study and become a physiotherapist, you need to go to a kind of a mainstream UK university. And then, so with the training, it tends to be split into kind of either cardiovascular, the muscles, joints, what we call musculoskeletal, and neurological physiotherapy. And so the training is a lot more widespread. And typically, what we'd see is that with physiotherapists, they would tend to they get more training, I would say, or their bias is a little bit more towards exercise and rehabilitation exercise. And then there's also other components such as manual therapy. And when I talk about manual therapy, I'm talking about kind of what we'd call maybe hands-on. So that could be soft tissue massage, that could be joint mobilizations, and things of that nature. So kind of it's a little bit more holistic, and everyone's going to have, and each physiotherapist will probably have a slightly different preference and bias and education with how they use those few things. But that's the general premise. So it's kind of a lot more wide reaching, whereas my understanding of chiropractic is that it's a lot more specialized profession based on the spine, based on manual therapy. But that's not to say that chiropractors can't then educate themselves on exercise and rehabilitation. And the difficulty is that where I think knowing the right professional, because you can get good physios, you can get bad physios, good chiropractors, bad chiropractors, which I'm sure we'll come on to later. But yeah, so probably the scope and the background of an individual chiropractor or physiotherapist might vary, but what I've discussed are the general differences between the two professions.
That makes sense. Thank you so much. That was enlightening, at least for me. I wasn't aware that chiropractic is potentially a little bit more focused than physiotherapy. And when it comes to the difference in scope of practice, so I am an online coach. I can provide nutrition services, and I am a qualified personal trainer. So what's the difference between my scope of practice and yours as a physiotherapist?
So I guess the main kind of scope of practice would be in, again, kind of what I mentioned around manual therapy and hands-on treatments. So I think unless you did any specific qualifications, then that would be kind of, I think, a major difference. And I think the other difference would be potentially who I could treat and how. So again, because I'm sort of regulated by the Healthcare Professionals Council, there's certain things such as manual therapy that probably I could do and that I get regulated on, and how I use those tools. So I think that would be the major difference, to be honest. And I think also with my sort of background education, I would probably have the ability to say treat people who maybe have illnesses or certain pathologies such as maybe arthritis or certain conditions. And I could say that kind of, oh, I'm able to, see people with a certain type of injury or a certain type of pathology or illness. So I think those are where the main differences lie. Yeah, that answers your question.
Yes, it does. Thank you so much. So now, in this part of the podcast, I'd like to discuss some aspects of training that some people consider facts, and I wonder if they are facts or myths. So if you could enlighten us, that would be awesome. And the first one I have on my list is the idea of letting the knees track over the toes when you're squatting. For some people, they might think that this is dangerous and not advisable for the safety of your knee joints. I'm wondering how true that is and if there is any basis for why that might be relevant to certain people.
So I think probably where that might have come from is when your knees tend to go further forward, it tends to load the knee joint more, which is fairly an obvious thing to say. And I think sometimes in some people and certain populations, they would start to get kind of knee pain. And I think this association and then myth kind of built up a little bit from there. Well, when actually it's perfectly safe to do so. So it's definitely a myth in terms of knees over toes. However, what I would preference is that there's massive individual differences, and something which hopefully is kind of helpful and not too much of a tangent is that there are really no universals. And what we've really got to understand and appreciate is that injuries, pain, that it is completely multifactorial in the sense that there's a combination of different factors which may feed into a person's pain or a person's injury, and those factors will differ to different degrees in different people dependent on their background, their kind of training history, their injury history, their lifestyle. Because again, that we know that things like, for example, if you're overweight or you've got comorbidities such as diabetes, that increases your risk for potential other problems like tendinopathies. So again, we've got to factor that in. Energy deficits, if someone's in a contest prep or if someone's kind of maybe not nutritionally managing themselves very well, that will feed into someone's injury preference. Stress. So all of these factors will all be doing this all of the time in different individuals, combined with the fact that everyone's got a different body type, a different body structure, and a different way of moving. And so if you it's a web of different factors which will be different for different people. And so the degree to which someone will be able to tolerate a certain movement will be completely different to someone else. And so that's why we can't make universal statements to say like, oh, this is bad and this is wrong. And we can't say that there's a universal best exercise for everybody, because it's just not true, because everyone is a completely unique individual. So I know that I apologize, that was a bit of a spiel, but I think that really puts into context where, because sometimes when people ask me these questions, I often sometimes, they might want like a black and white statement, but I often go, how do you feel? And, how does it feel for you? Now, also the other thing that we've got to factor into that as well is that just because you might get pain at one certain point in time, so for example, if you get pain in your knees when your knees go over your toes, that might be relevant at that point in time for you, whilst maybe you've got an injury or pain. But maybe in a couple of years' time, when you've maybe strengthened certain areas or you've strengthened the knees, perhaps you don't get pain anymore when your knees go over your toes. So again, there's a time component to things as well. So again, just coming back to your question, knees over toes is a myth, and actually, and it might, yeah. So, and we've just got to factor that into the individual. But again, which is relevant to kind of maybe some other points as well, is that pain isn't always equal to damage, and the body is meant to move. The body is meant to move. So I think that's what people have really just got to try and keep in their minds when they're doing these things.
Thank you for that. So let me see if I understood that correctly. What you're suggesting is that as a one-size-fits-all approach, knees over toes is a myth, but that doesn't take away from the fact that for certain people in certain seasons of their lives, perhaps having the knees go over the toes could cause pain, but that doesn't necessarily mean that then everyone should keep their knees from going over the toes.
Completely correct.
Perfect. And I believe that what you said about the fact that we can't really apply statements like this to everyone will likely apply once again in the next fact or myth that I'm going to ask you to discuss, which is it okay to let the spine bend when you're deadlifting?
Yeah, so I would say that again, if it's not, I think it depends on the degree of rounding. So, like, if someone is not necessarily in control of that rounding and it's very, very significant, I would say, or maybe be cautious with it, but I wouldn't say, oh, you absolutely cannot do it. And again, so I think the degree to which the spine rounds is kind of an important factor, but obviously we've got movements out there such as the Jefferson curl, which is a perfectly normal movement. So I think it is. I wouldn't want to use the word safe because again, there's not. I wouldn't want people to kind of take things to the extreme. But I would certainly say to people, don't panic if your back does round. And again, I would say that if you've got a history of maybe pain or a history of kind of problems or issues, to be cautious with that and to stick with movements that don't provoke kind of pain or injury. But no, again, I would probably say that rounding the spine is okay. Don't panic if it is. I think the most important thing to remember is that your body isn't made of glass. Your back is not made of glass. Your back is strong. Your back is meant to move. It's meant to be mobile and round. So, so I think rounding spine is perfectly a normal and natural thing to do. It's just when we go to loaded movements as well, that again, as long as you're not getting any significant pain and that the kind of form and technique, particularly as we get to heavier loads, the degree to which you do that and the degree to which kind of like that you feel comfortable with it is the most important thing.
That makes sense. And I think a question that comes to my mind is also, as you obviously know, the spine is divided into segments, but maybe the audience isn't aware of that. So I'm wondering, are there segments of the spine that you would consider safer to allow a larger bend, maybe, or larger degree of rounding than other segments? And if you can also describe them so that since this is not going to be a video rather, but just an audio podcast, then so that people understand what it is that you're referring to.
Of course, and that's a really good question. So typically, so if people can imagine maybe a spine, okay, and you want to kind of imagine essentially it's almost broken down into 3/4 major segments, okay. So if we start from the top, at the top, kind of from the head, you've got the neck, which is referred to as the cervical spine, and then sort of around kind of if you imagine the top of the shoulders here, where your collarbones are, from there down to kind of like the bottom of your rib cage, that's kind of the mid back, or what we'd refer to as the thoracic spine, which probably a lot of people are aware of. Then between kind of that top part of your the bottom part of your rib cage, and then the kind of your pelvic bones, and that's your lumbar spine, your lower back, and then we'd kind of refer to the kind of you've got the sacrum and the coccyx. So that's kind of like that fourth region. But that doesn't really kind of move a whole lot, and we don't always talk about that too much because it's kind of we associate that a little bit with the pelvis as well sometimes. So so you've got those components, and then the area where where it's probably a little bit for want of a better word, maybe safer, or that we can allow a greater degree of rounding is your thoracic spine. So, for example, when you're deadlifting and some powerlifters out there or people more familiar with deadlift, they might be familiar with names like what was his name? There was a famous powerlifter who deadlifted with a really, really rounded back, but it was mainly his upper back that rounded. So I would say that particularly if you're doing deadlifts, letting that upper back round the thoracic spine round to a greater degree is perfectly, probably a little bit more, again, like fine, and we can allow a larger degree of range of movement through that thoracic spine. And we probably want to kind of moderate and control the degree of rounding through the lumbar spine. Particularly now, I think another important thing is dynamically, how is it moving throughout the deadlift as well? So, for example, if kind of you start off in a fairly neutral or maybe slightly rounded position, but there isn't actually much movement during the exercise itself, then actually that's probably, again, perfectly fine. But if there's a large degree of motion that isn't very well controlled um, through particularly the lumbar spine, then again that might open the door a little bit to potential niggles. Also factoring in again where people are in terms of how fatigued generally, but also in the long term in terms of their mesocycle or training program, and in the context of other factors which we kind of have already spoken about.
Yes, that's very exhaustive. Thank you. Since we're on the topic of the spine, my next question is related to an occurrence that makes a lot of trainees, especially when they're a bit newer to training, panic a little bit. And they will come to me and say, hey, you programmed this bent over row or this barbell deadlift, and I could really feel it in my lower back. Is that a problem? And when somebody comes to you with this question, I'm curious about how you would approach it.
So I think I would firstly say no, it's not a problem at all, because particularly with compound movements like a bent over row, you're going to have, say your lower back muscles, they're going to be acting as synergists and assister muscles that are going to be stabilizing the lower back in order to perform the movement. Now, if someone's not used to that movement and it's a novel exercise, of course you're going to be getting DOMS, delayed onset muscle soreness. You're going to be getting some soreness through those areas. And what we'd hope is that actually don't panic about that, whatever you do. It's and particularly if you kind of look at their form and their technique looks good, we'd really want to just encourage them and say, look, don't worry about it. This is a novel exercise. This is what we're used to. We need to give it probably, a few weeks or, maybe a month just to let your muscles adjust to that. So I think the most important thing is, firstly, giving them reassurance to say, don't panic about it, and also just trying to put what they're feeling in the context of kind of the situation.
Perfect. Yeah, it's very similar to my own view. When a client offers their concerns about the lower back muscles, or rather this feeling in the lower back, I usually first explain that it is normally their musculature. It's it's not tissue damage, and it's not pain. It's more the sensation that you get when these muscles that we don't normally use in our everyday life very much first start getting a stimulus from training. And I explain, as you said, that they are involved in movements like a bent over row or a deadlift variation, and we can never really take them out completely. It doesn't mean that they're not also training the other musculature that we are trying to actually stimulate. It simply means that they are that they will feel the spinal erectors. That's why I'm saying they, the dear audience. The spinal erectors will likely rear their ugly head and be like, "What are you doing to me?" More so than these other muscles, simply because they are less well trained in that particular movement, and they need to, as you say, adapt to that stimulus.
And if I just may add on to that as well, I think
Absolutely.
I think with people who are very new to training, so they've got a very young training age, or perhaps they're just generally quite young, I think they I think people's ability to differentiate between what's a training related kind of pain, if you will, and
Hmm.
what's actual kind of, more injury related pain. And I think as people mature and get more experience with training, they learn to differentiate the two. So I think it's just about kind of bearing that in mind for coaches, and just kind
Hmm.
of not not necessarily sort of pushing them to their limit, but getting them over time to just get used to their bodies and gain experience with learning, like, huh, you know, that that's not actually kind of, that was fine, that discomfort. It's kind of sometimes like stretching, because sometimes when you first like do stretch your hamstrings or something, you're like, oh my goodness, that is like really sore. But then actually the more you do it, you think, oh, actually this is okay. And again, like I think as people mature and get more experience, they learn to differentiate the two and they become better at judging that. So again, that's just a really important factor, I think, for people to consider.
I agree, and that's a really good point. In fact, when a newer client comes to me with such concerns, I also try to give a definition of what would be a, a kind of sensation that I wouldn't really worry about versus a kind of sensation that I would. And it's difficult because everyone's perception of pain and soreness is different. But as it pertains to the lower back being active or the spinal erectors being active in a movement, I usually describe it this way. If it comes on sort of gradually and it's a low key kind of discomfort that just stays with you throughout the set, then you put down the weight and do you rest and you're fine again. That's what I would consider your spinal erectors working. I wouldn't be concerned with it. If it's something that comes on more suddenly, it kind of strikes you like a lightning bolt, and you feel like you don't feel safe continuing the exercise, that is something that then I would not consider to be within the normal realm of training your spinal erectors. I don't know how you would find that particular description.
Yeah, I think that's really good advice, Nikias. And I think the things that I would add to that is firstly, don't panic. Again, just take a moment, because suddenly people can be very reactive. They're like, oh, I feel pain, I feel pain, and they start to panic. And what
Hmm.
I'd say is like, right, just take a breath. Now, what are you feeling? Is it soreness? Is it, like you said, is it an ache? Is it just maybe tightness? Or is it, like you said, a sharp pain? Is it radiating, going anywhere else in the body? And sometimes when you put more descriptive language on it, it then starts to, you can then assess it better. And the other thing that I would say is then, okay, cool. So again, is it tolerable? Is it not tolerable? Um, and if it's kind of tolerable, okay, maybe continue, see how it goes, see how it develops. Is it something that's getting worse throughout the session? And do you need to maybe back off a little bit? Or is it something actually it's either staying the same, or maybe it's kind of getting better as you move through different movements? And again, that helps you kind of assess the situation. And again, what's it doing after the session? So typically, what we might find is that after kind of particularly if it was significant soreness, you might find that it might kind of linger a little bit, maybe for 1 or 2 days. But again, it's kind of in the background. It's not too severe, but then it will dissipate after maybe sort of 2 days or so. But then if it was kind of more injury related pain, if we call it that, that might be something, again, like you said, is maybe something a bit more acute, and it's something that persists, regardless of what you do. And that continues for longer than 2 to 3 days. So those are the kind of extensions that I would just add to that explanation, and hopefully, like, that gives people a nice gauge.
Yeah, I agree. And actually, the explanation you just gave leads really nicely into my next question, which is related to an Instagram post that you recently made that I found really interesting, where you were discussing when to push through pain, how to know when you can safely or relatively safely push through pain, and when it might be better to pull back, maybe skip the exercise or stop the session altogether, or maybe if the pain is persisting after the session, maybe not do another session for at least some time. So I would like you to expand a little bit on that if you can. How would we know when it may be safe to push through pain or discomfort?
So I think kind of, again, kind of relating it to training, I think firstly, where are you feeling the sensation? Are you feeling it in the muscles, or are you feeling it more in joints, or kind of like the connective tissues around the joints? And I think that's a key fact. And is it something which is, again, like more of a soreness, more of a kind of low key ache that's maybe just kind of there as you're doing the exercise? Or is it more sharp, and is it more kind of acute kind of pinching, or sharp, that you might not expect with exercise in the joints or in the connective tissues? So firstly, just trying to differentiate what you're feeling, and is it something that's kind of getting worse? and then actually using um, a scale almost, so a numerical scale of 0 to 10. So if 10 is the worst pain you can imagine, 0 is nothing at all, you feel fine. What I typically say to people is if it's kind of like a 5 out of 10 or above, that's when we want to stop and we want to reevaluate the situation. And again, that could be, is it getting worse or is it something that's just not going away? And I'd probably advise in that situation to either change the exercise or just maybe call it a day on that particular occasion and then reassess things. But if it's maybe between a 3 and a 5 out of 10 and it's not escalating, I'd probably say you're okay to again continue and then just again reevaluate how you're feeling the following day or in the following hours. But then if it's a 3 out of 10 or below, I generally wouldn't be too concerned about that, but I would just monitor it as again, particularly in future workouts as well, particularly the same kind of workouts, so that if there's a pattern emerging, whether it be, for example, technique related or whatever, then again, it just builds up a pattern and you can help to correct it. And I think just the key thing is that kind of like I mentioned in the post is, go to the pain. And I think it can apply to both. But particularly rehab exercise, I often say to people, go to the discomfort, but don't go through it. Now, this isn't talking about necessarily training hard, because again, when we're talking about with all things being normal and fine, obviously pushing to say like a 0 RAR or 1 RAR, you're obviously going to be pushing through a bit of discomfort there. However, if we're talking about pain in joints or things of that nature, that's when I'd be like, okay, well, go to the discomfort, but don't go through it. And again, just reevaluating it with your coach or with a professional would be the key things.
That makes a lot of sense. And I'm glad you brought up the aspect of pattern recognition as well, because as a coach, as I'm sure you know, that's mainly what we do. We try to recognize patterns. So I think it's very valuable for someone to think about, okay, when does this sensation actually come on? And if it's a one-off, like if it happened, the very first time it happens, I would normally suggest to a client not to necessarily panic, to certainly report it, and to explain to me where they felt it, when they felt it during the session, which exercise, and if there was a specific rep when it came on, what rep that was. And also I would assess their technique via a video. But then I would also reassure them and say, it's possible that your body will adapt next time and there is really nothing to worry about and it will not present itself again. But if it does, let me know, because then we can start to see a pattern emerging. Basically, what I'm trying to get at is that I feel that sometimes we are very protective of our own safety as a species, of course. So the first time you experience a sensation of pain or discomfort, it's easy to get scared. And what I am trying to suggest is to try and look for patterns before you jump to a solution where there may not need to be a solution to be undertaken at all.
Yeah, no, I think you're spot on there, Nikias, where, you know, it's like you said, pain is kind of an evolutionary thing. And immediately when that happens, it can be very natural and normal for our emotional reactive brain to want to jump, because that's our fight and flight. Our brain wants to protect ourselves and survival. But we really have to try to step out of that and try to get our logical brain back in gear, back in control, so that we can really understand what's going on and differentiate between the two. And like you said, with pattern recognition, with being curious about it and being like, okay, this hurts, or I'm feeling this, why? So I think that's like a key thing. But then I also think that there's a spectrum which if people can be self-aware of and know where they sit on it. And what I mean by that is, on the one end of the spectrum, you're going to have some people who are extremely analytical and they like to think about things. Now, they might overthink things, which isn't helpful. But then you've got other people on the end of the spectrum who might do no reflection whatsoever. They're not thinking about it at all. And you kind of go to ask them, well, what did you feel? And they were like, I don't know. And equally, that's not helpful either. We need that middle ground where people are curious, people are kind of tracking, and they're making kind of good logical kind of they're thinking things, and like you said, they're tracking, but they're not overanalyzing on the one hand, where they're getting themselves in a bit of a spiral, but they're still thinking about things a little bit. So I think there's that balance there with people as well.
That makes sense. And that's where a coach is really helpful as well, because we can offer that outside perspective that is hopefully unbiased, and therefore it can help ground the person so that they don't overanalyze the problem or underanalyze it, as
Yeah.
you were saying.
Yes, definitely. No, I completely agree.
And on the topic of, oh, actually, I think I lost my train of thought completely. Yeah, that's great.
Okay.
Give me a moment. Sorry about that. Oh, yes, I was thinking about what we've been discussing so far, and I really like that the perspective that you're taking is what I was hoping um, for the mm, I was hoping this perspective to be the main takeaway message from the podcast, which is that I believe there are some fear mongering messages being spread about pain and injury as it pertains to exercise. And I don't want people to feel disempowered and discouraged about exercise, because it is so healthful and it can strengthen the body. It's not going to break our body down. So, what I think would be interesting to talk about, if you know anything about it, is a little bit of a discussion about the realistic likelihood of injury associated with resistance training. How dangerous is it exactly, even relative to other sporting activities, for example, if you know much about that?
Yeah, absolutely. So it's interesting because the injury risk in, say, weight training, bodybuilding, if we talk about maybe bodybuilding and physique training, is probably the lowest of any activity you could probably do. I think probably the only things less than that might be walking, for example. You know, like honestly, like it's so low. Like it could be like I can't, because again I made a post about it and I've forgotten the numbers off the top of my head, but it's so low. It's like, it might even be something less than like one per year, you know, whereas if you compare that to something like rugby, you know, we talk, they will measure injuries per 1,000 hours. And again, it is very significant. We're talking, in the 30s, 40s and above in terms of the injuries that are sustained. And these can be really severe injuries. So I think, when people think about that, I think they've really got to understand that bodybuilding, but just training in a gym environment is incredibly safe, relatively speaking to other sports. And so I think people need to be really reassured by that. If they're following things well and they're being sensible with their approach, they've got a coach maybe, that it's one of the safest things that they could ever do, like I said. Yeah, absolutely.
Thank you so much for covering that. Now, let's say that somebody were to get injured. I think that a large aspect of recovering from an injury, a big obstacle to a smooth recovery is the mental side of it. And I'm talking about this from a personal perspective, even because I got injured back in 2019 and I was out of the gym for a whole month. And what I remember the most isn't really the physical discomfort, because, well, thank the gods I recovered smoothly from a physical perspective, but I remember how downcast I felt because I had gotten injured, how even worried I felt for a time after getting back into the gym about having it happen to me again. Essentially, having that experience for a time made me feel more fragile. So, since you obviously must have, I would assume, quite a bit of experience helping clients through injury recovery, what are your suggestions for people out there if they do get injured? How can they best approach the injury recovery process from a physical standpoint, but also from a mental standpoint?
Yeah, I think it's just such an important question because I think still a lot of people don't appreciate the degree to which, like you said, the mental toll that an injury or problem can have on someone. And I think people should also be careful not to compare their problem with someone else's, because how much a problem affects someone, you know, is totally different. So, for example, it's really important not to belittle an injury, no matter how quote unquote maybe severe it is. So, for example, someone could break their leg, but that's not to say that that affects someone any more than someone who maybe on the outside the injury doesn't look as severe, but that doesn't mean that's not affecting them as much. And I think, again, coming back to things like disability and so on, just because someone's disability isn't visible doesn't mean it's not massively affecting them hugely. So I think that's something really important. So for people out there who've maybe got a problem, even if it's not massively visible, don't downplay it and don't sort of beat yourself up thinking, oh, why am I feeling like this? Don't worry about that. It's it's really important that you honor and validate your feelings. And also, what they found in the research is that injuries, when someone experiences an injury, a person will often go through the grieving process. So people will go through different feelings and emotions. Initially it might be kind of that shock, oh, maybe this hasn't happened, and but then they might go into the phase of like, oh, why me? And why has this happened? This is so unfair, and blah blah blah. And then maybe they might go into a bit of depression, and all of those sorts of things. And again, not only will you go through them, you might cycle through them in different orders as well and go back to some. So again, if people can just understand that that's a normal thing to be experiencing, that will, I think, hopefully sort of help things a little bit. But then in terms of managing that, I think the most important thing is that there are going to be different types of support that people are going to need to help manage themselves. And I would normally separate these into kind of 3 different types of support. So we've got social support. So that's where you've got your friends, family, etc., who are just really there for you from an emotional perspective, who can just be there for you. Doesn't even have to, physically, they can be there, but also even if it's just on the end of the phone or a message or whatever, that social support is probably one of the biggest things someone can have during the injury process. But then you've got things such as informational support. So that might be again understanding about your injury, perhaps. So again, if you've got a certain injury, okay, well, learn about it. What is involved with this kind of injury? What's going to be the recovery process? What kind of things do you need to do? Those sorts of things. And that can really, having that understanding about an injury can really reduce a lot of the fear associated, because a lot of fear and a lot of emotional anguish with a injury or pain is because of the uncertainty of it. Like, you don't know what's going to be happening. But if you can educate yourself about things and just reduce some of that uncertainty, then that is going to be really key. And that's also, again, where, maybe a physiotherapist or a practitioner or a coach is invaluable during that time. Because, particularly if they have an understanding of that injury and your sport or whatever you do, they are really going to help to provide you with that information and that guidance that's going to give you that reassurance and feel better. And then finally, you've got tangible support, which is more just the practical side of things. So it might be, okay, you've got an injury or pain at the moment. Maybe you can't walk the dog. Maybe you can't drive yourself somewhere. And actually, how can you put things in place to help navigate those things? So I think if people can kind of understand that a little bit better, then that's going to really help them psychologically to kind of manage the injury side of things. So I think that's just absolutely critical. And there's going to be factors around that. And then physically, it obviously depends on the type of injury or problem that someone has got. But firstly, obviously, if there is, say, an acute injury, there's obviously a certain period of time where you've got to let biological healing take place. Now, that doesn't mean you can't be sort of mobile and active within those constraints of biological healing, but we still need to understand that there's going to be an element of biological healing potentially. And then you've got kind of that middle phase where maybe a lot of the acute biological healing has occurred, but actually we're looking to load and strengthen the tissues, build up the load capacity again of those tissues to build people back up again. And then kind of in that end phase, we're looking at kind of getting people to, get back into either their movement patterns or their sports, and kind of the kind of nature of that, and just gradually integrating them back into their kind of normal life. And again, the time scales of that are going to be completely varied depending on what the problem is. And again, even if two people have the same injury or the same problem, it can take different periods of time for different people due to a multitude of different reasons. So again, it's really important that people don't get kind of too caught up in comparing themselves to other people. And then the final couple of things which I just want to touch upon is one of the other things that is really which can really sort of trap people and cause a bit of emotional anguish is that we will often attach our identity to doing certain things or being a certain type of person. So, for example, if like I'm a bodybuilder, maybe like, okay, so I'm a bodybuilder, but now if I can't train for a period of time, you know, what am I? What do I do? What if I lose my profession and I'm not a physio? Oh, what am I if I'm not a physio? Or like a runner, I run, that's what I do, it's what I love, but if I can't run now, who am I? What do I do? So I think it's really important that people have other areas of their lives that they can really, when something happens, when they can't do one particular component of it, they can really lean into those other areas of their life, which is going to give them a lot of joy and satisfaction and take their minds off of the actual problem itself. So I think that's just a critical component to it. And yeah, I think those are kind of the main things. And there was something else I was going to, I think we might come on to it later, but I'll mention it now. So when it comes to things like training around it, in fact, I might come on to that a bit later. Maybe we'll come on to that. I don't know. Leave it there.
No, go ahead. Since you're already talking about it, please.
So again, like when it comes to training, so there's something known as the crossover effect, which is where there's a neurological crossover between different sides of the body. So, for example, if you say injured your right leg, for example, but your left leg was completely fine, actually, if you did some like leg presses just with your left side, there is going to be an element of neurological crossover in terms of strengthening to the injured side. So even if you can't move your right leg at all, even just by, exercising the left leg, at maintenance volume, potentially, you're still going to get good benefits on the opposite side, and you're not going to suddenly be totally, asymmetrical and stuff like that. So I think that's just something important for people to remember, and that knowing that there's always something that you can do, and it's just really important to, again, understand that and have someone who knows what they're doing and knows kind of things to really help kind of guide you about on that.
Thank you so much for your perspective. I agree with essentially all of it, and that's in large part what I tell my own clients when they go through injury, but also some aspects of your answer that particularly resonate with me do resonate because I tend to apply them to other areas of a person's experience with fitness. For example, what you said about honoring the fact that you experienced injury in a certain way can really apply to anything. Something that I feel very strongly about, that I will tell all of my clients, is that I don't believe in comparing yourself to what you believe should be the norm. Like, for what I mean by that is, as an example, saying, oh, well, I should be able to train 3 times a week for an hour, random example, because that's what people do. No, that's not what people do. There isn't a that's what people do scenario when it comes to really most things in life. These are just self-imposed standards that we kind of make up in our own mind, and sometimes they come from societal pressure, sometimes they come from our own childhood, they come from a variety of different places. But the point is that your unique experience, your individual experience is going to be unique. And there is nothing wrong about whatever experience it may be, because it's simply as it needs to be because it's yours, if that makes sense. And so that really resonates about, it really spoke to me when you said that.
And it's so easy to forget sometimes when you're in the thick of it. But if people can come back to that, or they can be reminded of that, then that helps. And it's not going to say that it's suddenly going to go away and you're not going to feel, it's not going to come back. But again, we've just got to keep coming back to that and just putting one step in front of the other.
And the other part that really resonated with me, and that once again I apply to so many scenarios, is the identity aspect that you discussed. And this is particularly relevant to me personally at the moment because I consider myself, well, a part of my identity is bodybuilding. I love bodybuilding, and for almost a year now, my ability to bodybuild has been severely impacted by some major gut health issues. And for me, if all I was a bodybuilder, I would have lost myself completely. So I've had to actually make an effort to think, okay, maybe I can't be in a gaining phase right now, or I can't be in a fat loss phase right now, but I can still train, which really helps my mental health. It helps set up my routine for the day. It helps me show up the way I want with the people that I love. And aside from that, I enjoy creative writing. I love my coaching business. I like working with my clients. There is always more to you than what you're doing in the gym or what you're doing with your nutrition or the injury that you are currently suffering from. And I think it's very important that you reminded people of that. Hello again. We are back after a bit of a technical glitch, but luckily we managed to save everything we talked about so far. My final question for you, Mike, since I'm very aware of time and you've already been very generous with it, I would like to give you the opportunity to tell people where to find you and where to connect with you.
Oh, brilliant. Thanks, Nikias. I think the main place where, from a coaching perspective, where people can find me is on Instagram, which is at Mike Revive Stronger. But also I've got a physio Instagram channel as well, which is at physio Mike Challis. So people can find me either way. I'm probably more active on my at Mike Revive Stronger, which is more my bodybuilding coaching channel. So I really encourage people to kind of follow me or just get in contact through there. I'm also, my email address is mike@revivestronger.com. So if people want to send me an email, I'd be more than happy to have a discussion with people about anything. So I think those are the main places really, and just really open to people, just chatting, engaging. It means a lot. So so that'd be awesome.
Excellent. I think that this conversation was really thought provoking for me, so hopefully it will be for the audience as well. So I wanted to thank you once again, Mike, for coming on. And before we go, is there anything that we touched upon that you'd like to maybe discuss in a little bit more detail, or is there anything that you would be really keen for the audience to take away from the end of this podcast today?
Yeah, so I guess it would just be kind of summarizing some of the things we said to kind of um, not fear pain, not get caught up in universal kind of black and white statements that this movement is bad or that movement's perfect. There is no universal. I think the best thing people can do, particularly if they're maybe new to this sort of thing, is to get a coach and is to kind of learn more about these sorts of fields and find someone who can help them and help them navigate certain things, and just be curious. Try to be self-aware but not over analytical, and kind of if you are managing, experiencing, or having to deal with an injury, a pain, or just an issue, know that it's not going to last forever, but honor your feelings, honor kind of who you are, and what you're feeling, but know that it's not going to last forever and that there's always something that you can do, regardless of the situation that you're in. And if you can just seek out good people like Nikias, like Steve Hall, like all of those good people like that are out there, and also just finding role models as well, I think is really key. So maybe people who've either gone through a similar injury or problem, such as yourself, I think so critical, so that you can kind of reach out to them, or you can just understand how they dealt with that situation. It might not be exactly the same because everyone's an individual, but at least if you can learn from them and know the types of things to do, then I think that's going to massively help someone. So seek out good people. There are good people out there. Don't be disheartened if you do have a bad experience with somebody, because there are good people out there. Just keep following them, and hey, just remember, sometimes it takes a long time, but just keep putting one step in front of the other and you're going to get there.
You put the best bow on this conversation that I could have wanted. So thank you very much, Mike. Thank you, dear listeners, for tuning in as always. And until next time. Lastly, if you want to support the podcast and help me reach more people, please leave a 5-star rating or review on any podcast platform that you're using. Thank you very much for listening, and I'll speak to you soon.